Assalamu alaikum, dear audience. It's my pleasure today that I am Dr. Atikur Rahman going to present my topic on sample and sampling technique, and I'm working as an associate professor and head Department of Community Medicine of Anwarkan Model Medical College, and I am also holding the charge of Phase 2 coordinator. I will try my best to give you a clear idea about the sample and sampling technique. Actually, a researcher is always try to draw inference on the population on the basis of some research question or the hypothesis. But in real situation, it is not possible in most of the cases to address each and every member of the population. That's why he or she have to pick up a sample from the population, which should be representative to provide a near accurate results of his or her studies. That's why I think that it is very important for a researcher to be very clear about the sample and sampling technique. So at the end of my presentation, I think the audience will be able to conceptualize the steps of research process, research jargon related to the sample and sampling technique, the reasons for sampling and the different types of sampling technique, and also this selection procedure of sampling technique for the specific research process. This is the basic diagram of the research process, which start with the problem identification, then literature review, setting research question or hypothesis and objectives, choosing specific research design, deciding on the sample size and sampling technique, then data collection, data processing, analysis, and on the report writing. Here the most important steps is the sample and sampling technique, and I am going to discuss in details about the sampling and sampling technique. Before I go in details about sampling and sampling technique, I think that some research jargons should be clear before I go in details. First of all, the target population. The target population is the entire group of study subjects on which the results are generalized or extrapolated. And the study population is the convenient subgroup of the target population from which the sample is actually taken. Here, if I set an example for these two definitions, suppose the study group is the under 5 children of Bangladesh. Actually, it is not possible for a researcher to address each and every under 5 children of Bangladesh. Then you can choose the primary school as a subgroup of the target population as a study population, and the sample is taken from this primary school children. And the sampling frame is the total list of all the study population. So if a researcher make a list of all the primary schools, this will constitute the sampling frame. And sampling unit is the unit of study population chosen for the member of the sample. So the total sampling unit that is usually taken from the study population as a sampling unit constitute the sample size, and the process by which this selection procedure is done to form the sample is the sampling technique. Why we should do the sampling? Actually, we do sampling to get information about the large population in less costing, less field work, with more accurate data collection, with easy accessibility in difficult to access population. Now the types of sampling with the design process. Actually, this procedure starts with the definition, with defining the study population, with determination of the sampling frame, and then determination of the sampling procedure or the technique, which are again divided into two: probability sampling technique and non-probability sampling technique. The probability sampling technique is contains some subgroups, that is simple random sampling, systematic sampling, stratified sampling, cluster sampling, multi-stage sampling, and multiphase sampling. On the non-probability sampling technique type, it contains the convenient or purposive sampling, quota sampling, and snowball sampling. And after deciding the appropriate sampling technique, then it is then the calculations sample size is calculated, and then execution of the sampling design. Here are some features which differentiate probability sampling technique from the non-probability sampling technique. Actually, in probability sampling technique, the subjects have the equal chance to be included in the sample, but in case of non-probability sampling techniques, that does not have any equal chance. Lottery or random number table is usually used for random selection in probability sampling technique, but in non-probability sampling, it is totally done by the choice of the researcher. In probability sampling technique, sample is representative and generalizable, but it is not representative and not generalizable. And probability sampling technique is good for the analytical study. On the other hand, non-probability sampling is usually good for the descriptive study. A statistical test can be rigidly applied in case of probability sampling technique, but in case of non-probability sampling technique cannot be rigidly applied, and it is difficult to do for the probability sampling technique but easy to do in the non-probability sampling technique. Probability sampling technique, the most important and most commonly used is the simple random sampling technique, and this technique is usually done in case of a small homogeneous population or easy to access population. A simple random sampling is done, and in simple random sampling technique, first the population is numbered to form a sampling frame. So here you can see that here the sampling frame is done. Sampling frame is done by numbering the population 1 to 12, and from this sampling frame, sampling unit 2, 5, 8 is selected from this population by lottery or random number table, and this is the main principle for doing the simple random sampling. Now the systematic sampling technique. In a systematic sampling technique is done when the population size is big enough to access by the researcher. In this case, the sampling unit is selected systematically at a definite regular interval down the sampling frame. In systematic sampling technique, the sampling frame construction is a prerequisite, but it is not mandatory in some cases. Here in this example, I am using the sampling frame by numbering the population as a sampling unit from 1 to 12, and from this sampling unit, from sampling frame, the first sampling unit selected by the by the random number table or simple random sampling technique or lottery, and next sampling unit is chosen by a definite interval. Here it is every third interval, third interval this second unit is taken, and then third unit, fourth unit is taken, and this interval is determined by dividing the total number of population by the predetermined sample size. Here the interval is 3, population is 12, so predetermined size 4, so interval is 3. Stratified sampling technique. A stratified sampling technique is done when the population is heterogeneous, large, In that case, the researcher divide the population into homogeneous strata on the basis of some relevant characteristics, suppose the age, sex, religion, education, which might have influence on the outcome variables. So here in this example you can see that 12 male and female students is constituting a heterogeneous population, and this heterogeneous population is divided into two strata, male and female strata, on the basis of sex. And from these two strata, male and female strata, sampling units taken from this strata by simple random sampling or systematic sampling technique. Cluster sampling technique. Actually, the cluster sampling is similar to the stratified sampling technique, but here one difference is that in cluster sampling technique, the population is divided into natural groups or cluster. Natural groups of clusters, suppose the village, factory, schools. From this here in this example, study population is 5 to 10 years. Study population is the 5 to 10 years children of Bangladesh. Here the population is divided into cluster on the basis of the upazilas. So in upazilas, 5 to 10 years children are contained in these upazilas, and each upazilas is the cluster. Here there are 6 clusters. From these 6 clusters, 2 clusters taken by the simple random sampling technique or systematic sampling technique, and within each cluster there is heterogeneous subjects, but in case of strata there is homogeneous or homogeneity maintains in each strata, but in cluster there is heterogeneity is maintained in the cluster. And this is the basic difference between the cluster sampling technique and stratified sampling technique. Multi-stage sampling technique. In multi-stage sampling technique is usually done stage by stage, and stages are determined by the naturally occurring geographic area or arbitrary hierarchy levels. Suppose if in this sampling technique, if we consider the study on the nutritional status of the under 5 children of Bangladesh, in this study the study population is in the under 5 children, and the problem area is the nutritional status. So it is not possible for a researcher to address the each and every under 5 children of Bangladesh. So in that case we can divide this country into 8 division, and from this 8 division, 80% of the division can be selected by simple random sampling technique. And again this division contains the districts, and from this selected division 50% of the district can be selected by simple random sampling technique. And similarly these techniques can be applied for the upazilas, union, village, and up to the household levels. In the household level, 50% are household are selected as a sample size, and from this household levels the data collection are done. Here it is the nutritional status of the under 5 children is assessed from the household level. So here the one important point that should be considered in multi-stage sampling is that in the initial stage maximum sampling units are taken, and gradually it becomes fewer to maintain the maximum representativeness of the sample to the study population. And another important thing is that the data collection is taken in the last stage of the sampling procedure. Multiphase sampling technique. Multiphase sampling technique is usually done phase by phase, and these phases are determined by the characteristic features of the study subjects. And unlike the multi-stage sampling, similar type of sampling techniques are selected at each phase. Here, if we consider the study on the prevalence of pulmonary tuberculosis in Savar Thana, actually, if we consider the total population of Savar Thana is 3.5 lakhs, so it is not possible for by researcher to address each and every people in Savar Thana, and if we consider the PCR, sputum PCR is the gold standard test for pulmonary tuberculosis, so it is not actually possible in reality, and it is not ethical to perform the sputum for PCR for each and every people of the Savar Thana. So in that case, researcher can identify the people by the clinical features of pulmonary tuberculosis. If suppose here it is 35,000 patient, again this 35,000 patient can be selected for testing ESR, and 18,000 patient become high ESR, and these again 18,000 patient will undergo the chest X-ray for pulmonary tuberculosis, and 8,000 patient become the positive X-ray positive for pulmonary tuberculosis, and this 8,000 patient then undergo sputum PCR, and it become 5,000 patient for positive PCR, positive sputum PCR, and this 5,000 patient can be used for the determination of prevalence of pulmonary tuberculosis in Savar Thana. So the important point in multi-phase sampling technique is that here in each phase the data collection is taken place, which differ from the multi-stage sampling technique where the data collection takes place only in the last stage. And another important thing is that in each and every phase the same patient, same sampling unit is used for sampling technique, but in multi-stage sampling different sampling units entered in different stages for sampling technique. Now the non-probability sampling technique. In non-probability sampling techniques, the most important subgroup is the convenient or purposive sampling technique. Actually, this sampling technique is done in situation where the purpose is usually exploratory to get the feel of the situation. Suppose if we consider the suppose the survey on the morbidity of rural household attending the Upazila health complex, and here the picture shows the population, and the researcher considered the one end of the population for data collection, for selection of sample size for data collection, which he considered easier to access and more proximity to his or her place. So this sample does not represent the whole populations, and so it is non-probability sampling technique. And another important point is that in purposive or convenience sampling technique, sampling frame is not done. The quota sampling technique. In quota sampling technique is usually done when the population is heterogeneous, then it is divided into subgroup or quota on the basis of relevant characteristics which are known to have influence on the study results. Suppose age, sex, religion, education. Here in this example you can see that the population is divided. Population is divided into some quotas. Suppose age quota, age on the age characteristics. Here the different age group are the quotas, and from this age quotas the sample is sampling unit is taken by the confident or purposively. So 60 total 60 is the sample size in this quota sampling technique. Snowball sampling technique. Actually, the in snowball sampling technique, the researcher recruit the initial subjects, and then he is requested and convinced to work as an informant to identify the others to be included in the sample, and this process go on till the desired sample size. Here in these pictures, the initial subjects recruited by the researcher, then this initial subject recruit the additional subjects, and in this way it forms a bigger size, and actually is similar to the formation of snowball. So in this so that's why it is called the snowball sampling technique. Actually it is done in hard to find population, suppose heroin users, street sex workers. Selection of appropriate sampling technique. Actually the sampling technique selection depends upon the type of the research, size and characteristics of the study population. According to type, qualitative and quantitative research. In case of qualitative research, purposive sampling technique, quota sampling technique and snowball sampling techniques are used. And in case of quantitative sampling technique, simple random sampling, systematic sampling and stratified sampling technique are used. According to size and characteristics of the population, if the sampling frame is difficult to make, dispersed and difficult to approach, in that case cluster or multi-stage sampling. If the population is less representative of a specific group, in that case a stratified random sampling technique. Actually a researcher can choose one or more sampling technique as per need of the study. So it is not hard and fast rule to use this procedure, but this is the minimum requirements for selection of the appropriate sampling technique. These are the reference for my lectures, and at the end, thank you everybody for patience hearing, and thank you so much.